Hi, I'm Dr. Anthony Bacevice, former past president of the Academy of Medicine of Cleveland and Northern Ohio, and also on the board of the Academy of Medicine Education Foundation, a former host of the Healthlines program that was on the air for several years in this area. Today, I'm coming to you from the Academy of Medicine President's Room with the incoming president of the Academy of Medicine of Cleveland, Dr. Robert Hobbs. We're welcoming him to our leadership, and today we're going to spend a little time finding out who Dr. Hobbs is, a little more about him, and what his goals are for the Academy over the next year. Dr. Hobbs, it's good to see you this afternoon.
Thank you.
And let's talk about you a little bit. Tell us about yourself and your medical practice.
So I am a cardiologist. I worked for 38 years at the Cleveland Clinic, specializing in heart failure and heart transplantation. Although most of my time was spent in patient care, I was also active in teaching and clinical research. I spent about a third of my time in the cath lab, a third in the hospital, and a third in the outpatient department.
I can say from the time when I was in training and Dr. Hobbs was a new faculty over there, he was one of the most interesting and illustrative instructors that we had when he would give lectures in grand rounds, and I will still never forget that. What got you interested in medicine, Dr. Hobbs?
Well, I grew up in a family of medical professionals. My father, my sister, my uncle, and my cousin were doctors. My mother was a nurse anesthetist. And as a boy, I spent a lot of time hanging around hospitals, tagging along with rounds, talking with patients, and marveling at medical equipment. In college, I worked as a lab technician and an autopsy assistant. So for me, medicine was really the only choice of career.
Amazing. What kind of accomplishments or what accomplishments are you most proud of in your career, Dr. Hobbs?
Well, in education, I received the Distinguished Teacher Award from the Cleveland Clinic, and teaching is one of the most gratifying things that you do in the practice of medicine, and this award was given by the medical residents at the clinic. In terms of patient care, I'm proud of the fact that I co-founded the heart transplant program at the clinic. And that was back in 1984. And since then, it's grown into one of the top 3 transplant programs in the country. In terms of clinical research, I'm also proud and a little bit lucky that I was the first to administer a new heart failure drug to patients. And 7 years later, after many clinical trials, that drug was approved by the FDA. And finally, in terms of advocacy, I am honored to serve as president of the Academy of Medicine.
That's terrific. You have quite the career with many accomplishments, Dr. Hobbs. On your personal side, tell us about your family a little bit.
Well, my wife raises and shows Labrador Retriever dogs, voted yesterday as the most popular dog in America. So there are a lot of wagging tails in our house.
And I bet some hair on the carpet from time to time.
And you are correct.
What about hobbies and interests for yourself, Dr. Hobbs?
Well, I have a lot of interests and hobbies. I enjoy cooking, I brew beer, I make wine. I belong to several organizations, most notably the City Club and the Pasteur Club. I'm currently taking courses in music, art, astronomy, and history. I enjoy going out and exploring Ohio. I attend concerts throughout the Cleveland area, and I enjoy going to programs put on by the Art Museum and the Natural History Museum. I enjoy fly fishing, and I enjoy being an Indians fan.
That's wonderful. I can't help but ask if the name of your beer is Hobbs Hops, or Hops from Hobbs.
It's Black Dog beer.
Black Dog beer. Okay then, well, I was wrong. Dr. Hobbs, what are your goals and your priorities as we move into your presidency, the year that will begin in April at our annual meeting? What do you have in store for us at the Academy of Medicine?
Well, I expect to work hard to represent the Academy as an advocate for physicians and patients and the practice of medicine. We as physicians need to be vigilant about legislative proposals and legal decisions that affect the practice of medicine. We constantly need to support the tort reforms that were enacted years ago but are under constant threats of repeal. Much of our work at the Academy is behind the scenes. We're not out in front, but we are working vigilantly, meeting with legislators, meeting with state officials. We provide testimony before the legislature in Columbus and advocate constantly on behalf of physicians.
You know, that's an important component, and as you mentioned, it's all behind the scenes. There's so much that goes on within our profession, many things that are not within our control, and it's up to people like yourself doing the work that you're doing now and you will be doing for the Academy to make sure that that continues on. What are your concerns about the future of healthcare, Dr. Hobbs? We're in a time of change right now, as you well know.
Yeah. I'm concerned about the loss of autonomy of physicians. Many physicians now have become employees of large healthcare organizations. They seem to be burdened by the electronic health record, which has become a barrier between the doctor and the patient and has made their practice of medicine very inefficient. I am concerned about the constant assaults on tort reform that we worked so hard to get a number of years ago. I do not want to see a return of the malpractice lawsuit crisis of the 1980s and 90s.
That was a very tough time for all of us that were practicing, whether it was in independent small practices or for organizations like the Cleveland Clinic. Dr. Hobbs, how would you ask physicians to support the Academy and why?
Well, I would ask them, number one, to join the Academy or to maintain their membership in the Academy, to keep abreast of the issues affecting medicine by reading our emails, our publications that are current as to the legislative and legal issues. They need to stay engaged and involved and not allow the parent organization to run things for them. I would ask them to try to attend the Academy functions, both the educational programs and the social functions. And if they are passionate about healthcare, to join the board, become board members and work alongside of us.
Anyone who's interested in becoming involved with the Academy of Medicine then can either contact you, contact a member, or contact the Academy offices, I would imagine.
Yeah, and also the website will get
That's
them
right.
involved.
www.amcno.org. Anything else, Dr. Hobbs?
Well, I want to say that I'm deeply honored to become president of the Academy of Medicine. I look forward to a busy and successful year. I'm hopeful that we can make an impact on the healthcare and future of medicine in Ohio.
As long as people like you are at the helm with the backing of the membership, I think we will accomplish that with a significant measure of success.
Thank you.
Dr. Anthony Bacevice, thanks for listening and watching this afternoon, and we wish Dr. Hobbs the best over the next year.